In December 1987, Dr. Chawalit Ongcharit, Professor of Cardiac and Thoracic Surgery and a team at Chulalongkorn Hospital performed Thailand's and Southeast Asia's first successful heart transplant operation on Pichid, a 19-year-old schoolboy. He'd been diagnosed as having dilated cardiomyopathy and was given only a few months to live. He received the heart of a 45-year-old woman who was declared brain dead after a massive hemorrhage.
We need her heart to give to another young man who is dying of acute heart failure with no other way to treat this man. And they agree. That was the first start, and it was quite success. I can say he used normal life. He go out and he worked. He got a job work in the rehabilitation health center of the Thai Red Cross. At first as a general worker, and meanwhile he studied computer technology. And now he is computer technologist of the center. And he also play game badminton. When I heard about it, I sent him to the trainer, national trainer, and sent him to the World Transplant Game in Canada to participate in, and he won a silver medal for single men badminton. And now he lived longer than anybody after heart transplant in Asia for 27 years this year.
Because of his tricuspid valve regurgitation, Pichid underwent 2 successful valve replacement surgeries in 1997 and again in 2009. Only this time, his surgeon was Dr. Pat Ongcharit, Professor Chawalit's son. Like father, like son, Dr. Pat received his MD from Ramathi Bodhi School of Medicine, Thailand in 1994. He was a resident in general surgery, followed by cardiothoracic surgery at Chulalongkorn Hospital. Following his training in Thailand, he continued his practice in thoracic organ transplant at Papworth Hospital, Cambridge University, UK. When he came back to Thailand in 2003, Dr. Pat resumed his duty as a consultant cardiothoracic surgeon at Chulalongkorn Hospital and head of intrathoracic organ transplant unit, which was founded by his father.
After I came back from England in 2003, I worked here as a consultant surgeon for cardiothoracic surgery, responsible for heart and lung transplantation. And we do about 10 to 12 heart and lung organ transplant at this hospital every year. And the numbers increase every year. And we try to expand our work more and more.
Through his professional working experience, Dr. Pat is on the committee of the Thai Transplantation Society, dedicating his time to heart transplantation enhancement in the country as a whole.
Heart and lung transplantation is very demanding and very complicated. Physicians have to be very careful in every step, starting from donor selection, recipient selection, timing of the transplantation, operative techniques, perioperative care, and post-op management, especially immunosuppressive agents. To achieve all these is demand all the teamwork and all the knowledge about transplant for the ultimate goal of having good quality of the recipient.
Dr. Pat and his father are great role models of lifelong care, with a father passing on specialist knowledge to his own son. Both are truly dedicated and strive to achieve best practice care of transplant patients. They are an exceptional and one-of-a-kind doctor family.